All right, this one's for the boys. We're talking about delayed ejaculation. Yes, this is a disorder. Doesn't happen very often. Usually it's a small percentage, but it is ever growing with the advent of access to pornography. So what is it? So it's usually it's something where it's an occurring, it's the inability to ejaculate during sexual intercourse, either almost we're talking about 75% to 100% of the time with partner sexual activity, and without a desired delay. This is something that they're not trying to achieve. There can be a delay in ejaculation or in frequency or absence of ejaculation. It's something that they're not intending to do. I know there is certain sexual practices where you can delay ejaculation, and that's intentional. This is not intentional. Someone with this is not actively trying to prolong their sexual experience. They just are having difficulty or unable to ejaculate at orgasm. Has to be present for at least 6 months. And it has to cause distress in relationships, meaning that the partner and them find that they are having difficulty on what this actually means to themselves and to their partner. So it's causing distress in this. And typically it has to be not explained by another mental disorder or a consequence of any kind of severe relationship distress or other stressors. And it can't be due to a substance or medical condition. It can be lifelong, meaning this has always been the case for that person. It can be acquired, meaning that they were sexually active for a while and this came about. Also can be generalized, like not limited to a specific stimulation or situation or partners. It happens kind of all the time. It can be situational, meaning that it only occurs in certain situations with certain partners or certain stimulations. It can be mild, moderate, or severe. That's usually kind of up in the air. There's no definitive answer on whether it's mild, moderate, or severe. It depends on how much distress it's causing in the relationship. Typically, it's associated with a high frequency of masturbation. Someone that masturbates frequently is going to find that they're going to have less sensitivity, and the techniques that they're imagining can't be duplicated in that partnered sexual activity. And there's usually kind of a disparity between the fantasy of what they are imagining and what the actual reality is. So they're not getting as excited when it actually comes to real partnered sexual activity compared to what they imagine when they're by themselves and masturbation. And also it can be influenced by other factors. We're talking like relationship issues too, psychological issues, could be stressors. Stress can really kill a man's libido, and also can be age, could come with medication, come with medical condition. So a lot of different factors. This one really should be treated by a sex therapist if finding a good one is important. Also, some medications can help, and other types of going to a urologist to see if there's any medical conditions that need to be addressed that can lead to it. It's a good course of action to take. Guys, hope this helped for you, and we'll see you next time.